Okay, well, a huge welcome to everybody for this month's iThrive Community of Practice webinar. Today's focus is on developing a Thrive-aligned outcomes framework, and as we know from our work with sites across the country, this is a significant challenge in bringing together the cross-sector outcomes to both be able to monitor closely any changes across the system and also identify where we might need to move resources in a timely way as required. So there are huge challenges in bringing together an outcomes framework across the system, and I'm really delighted to be able to welcome colleagues here today from Kate Dalzell from Cork with their expertise on outcome tools and using outcomes across teams, services, well, on an individual, team and system level. So thinking on that macro, meso and micro level of the Thrive framework, and also colleagues from the Greater Manchester team who have been using some system-wide impact and outcomes tools to be able to monitor the fantastic work they've been doing across their 10 localities across Greater Manchester. So a huge welcome to Angela Daniel, Sam Gittins and Kat Taylor, who's also going to be sharing some work that's been done, really creative work on looking at ways in which we can develop system-wide outcomes tools in relation to arts and culture. So before we begin today's agenda, just some housekeeping notes. Apologies, I'm not very good at remembering to introduce myself. So I'm Rachel James. I'm the Clinical and Programme Director for the National iThrive Programme, supporting sites across the country in implementing the Thrive framework. You will have seen a message as you joined the webinar to say that it will be recorded and we will be uploading it online. So anybody can access the webinar later if they've not been able to join today. So that's our reason for requesting your permission to record. Please do keep your camera turned off and mute yourselves. But if you're asking a question in the Q&A slot, of course, please do put yourself on view and take yourself off mute to be able to contribute to those discussions. If you do need to raise a technical issue, please use the chat function. It will be monitored by Bethan and Neelam, the iThrive team colleagues who are on this call also, and they will ensure that we attend to it as soon as we can. Please do use the chat function to share any questions or reflections of the presentations as we go through them and indicate who you'd like it to be addressed to. We are going to be asking everybody to hold on to any questions and specific reflections for the Q&A session. So if you can put them in the chat as you go, then we'll be able to monitor them and that you won't forget them. But if you would choose to do that anonymously, then there is an option to do that if you don't want your name to be included. So we will send out the slides following the webinar, as well as that link that I mentioned to the recording. And if you've got any questions or reflections following the webinar, please do link with the National iThrive Programme team at the usual address ithriveinfo@tavi-thorpe.nhs.uk. So I did a little bit of a summary of the agenda and introducing my colleagues. So Kate Dalzell is going to kick us off in a couple of moments with the overview of work from Cork, very much focused on using outcome measures for use at different levels across the system. And then Angela is going to present that work of developing system-wide outcome framework across Greater Manchester. As with any Zoom session, we do know it can be a challenge to retain attention and concentration, and so we'll be taking a comfort break at around about 11:20 for everyone to do some star jumps and replenish or relieve oneself of fluid. So we'll make sure that we do that before then moving on to Kat giving us an overview of the work in relation to an arts and culture outcome framework in Greater Manchester. So that will all take place before the Q&A for the last 15 minutes. So you can see it's quite packed. So I will end there and hand over. No, I won't. Actually, I want to, yes, Thank you, Neelam, for that little nudge. We as a programme team are absolutely committed to equality, diversity and inclusion, and look forward to encouraging all sites to collaborate further and embedding equality, diversity and inclusion across the different localities and the work of the Thrive framework to really actively and proactively promote equitable access. And what we want everyone to be mindful of during today's webinar is how we together can really support the use of representative outcomes across the system that enable us to evaluate holistic outcomes and that ensure that the tools that we are thinking about are valid and meaningful for the needs of the specific populations that we're thinking about. So thank you for that prompt, and I didn't want to miss that slide. So it's really about how in all this work that we're thinking about today, we really embed thinking around equality, diversity and inclusion at every level in our practice. Okay, so now I will hand over to Kate Dalzell, who's going to share her fantastic work with Cork. Thank you, Kate.
Sorry, I was a bit slow. I feel like other people do that a bit more slickly than I do. It's lovely to be here. Thank you for having me. I'm Kate Dalzell. I'm the head of the Child Outcomes Research Consortium. And just to say what that is, the Child Outcomes Research Consortium is a membership organisation. Our members are health service providers, schools, research bodies, who are all really committed to collecting information about outcomes from their routine care and getting that feedback and data from young people and sharing it together so that they can learn from each other about how they use and work with that data, so that we can look at that data across the board. Yeah, so we're all about using real world evidence to improve systems and support, and we have a website with lots of tools and useful things on it, so do look us up. Yes, Rachel and team said to me, Kate, will you come along and say some things about using outcome measures across the system? And I took that away, and I must say that I feel like I could talk about this endlessly and for hours and across a ridiculous range of issues. And so I've tried to give you a bit of a mixture of kind of principles and overarching approaches and maybe a bit of tools. And I know that Angela and Kat are going to do some really really inspiring, I think, really great examples of the work that they're doing, which is quite applied. So I haven't gone too much into examples. So I hope it's a useful full frame. And kind of coming up at this from Thrive, am I missing one? Oh yeah, coming at this from Thrive, I think that there are some principles that particularly stand out for me for Thrive, and when we're looking at a cross-system use of outcomes, are really leaning on these in particular. And that is how, when we think about outcomes cross systems, that can be at the core of the common language that we have, our common conceptual framework. And that if we are gathering and looking at that information across the board, it's going to help us in defining and understanding needs. And that's at all levels, at the kind of across the population and in a service and an individual, that if we've got a way of thinking about outcomes, that helps us be needs led. And that if we do that together, it's a massive base to our partnership working, and that to have an open conversation about how we think about that in a collaborative way, and how the different outcomes that we might each focus on come together, is a really key aspect to our being able to work collaboratively and be respectful of the different places that different services are coming from, and the world that they live in, if you like. And of course, being outcome informed means that we can be clear about the kind of support that we can do, and that we can monitor our progress. So in this kind of, you'll all be familiar with exhortations to measure outcomes. And so here, for example, from a health perspective, would be future in mind and local transformation plan perspectives. This kind of measuring and tracking what you do, and being clear about that is very much seen to be part of transparency and accountability. around kind of rigorous service transformation, collaborative practice, evidence-based approaches and things, and feedback, and monitoring improvement approaches. But I think I would go a bit further thinking about this in the Thrive context, because I think what we're looking at here is really also that shared understanding and how we work as a system to hold in balance the different aspects of quality of life for either a thriving population and holding in balance different aspects of appropriate help and support to meet the needs and preferences of the people that we're supporting. So I think that that's why that's kind of an additional thing I think that we see in a Thrive context. And as I said before, that it really is an underpinning for partnership working and kind of how we mobilise our resources around the children and families that we're working with, and really see the contribution that everybody's making and hold that in awareness. But also a lot of the work that we've done with systems that think in a Thrive-like way, they've seen thinking about how outcome measurements play out across their system and their outcome framework as a real opportunity to build into the middle of their system and into their kind of the core of their work, how those goals and outcomes that matter most to people are in there, and how we're responsive to them on an ongoing basis by getting that feedback on an ongoing basis. So just to say, oh, my gift's working, that the fact of the matter is, in most areas, when we come in and talk to people, the reality is that everybody's got really specific things that they've got to deliver on. And it might be set by government and it might be set by your funder. And all of the individuals that we work with have got really specific skills and professionalism. They've got particular trainings, and they see things foreground differently depending on those contexts. And that's just that's kind of an aspect of multidisciplinary work, isn't it, to be holding that in mind. But another challenge for this is that the children and people, families and carers that we work with, their needs don't tidily box, and it always feels much more complex and unique and difficult to track how we're supporting and working with those people. So when we come in and start talking about outcome frameworks, we're actually in a very messy environment and a very human environment. And all of those things are really important because they're part of the richness of what we do, and they're part of how we work and support communities well. So we really need to make sure that we kind of encourage that mess and encourage that complexity and support that in the approaches that we build in. So everybody wants the best for people, but they're all focusing on slightly different things, and sometimes feeling boxed and feeling like they could be conflicting with their fellow professionals and things mean that perhaps they don't even want to measure things, Lord forbid. So that's the kind of place we're starting from, really. So that being the case, the kind of values and principles that me and the team kind of went through this again and said, what have we really learned from where we've been doing with people? And I think it's really simple stuff. It's just that it's got to be relevant and meaningful. So it's got to be co-produced. So it does reflect those different perspectives and hold those in balance. And if it doesn't have buy-in from the different aspects of the system, then it won't stick. And in particular, if it's not useful and purposeful in those aspects of this, then you won't kind of get that embedded measurement and use of outcome data. So that means it's got to be connected to decision making. It's got to be seen and discussed somewhere where action can happen in response to it. And we're going to talk about the different levels in a second, but that might be strategic government, it might be management, it might be direct care and support. And in fact, it needs to be all of those things. And it needs to be practical. So sometimes really smart thinkers, sometimes it's good to have a lot of detail, and sometimes it's good to have more of a balanced scorecard and be able to see a big picture. And to think about things like lead indicators and then dig into things where issues arise. So there's something as well about proportionality and making sure that you are choosing outcome measures that you can work with well. Do what you can do well, and don't go over complex and over into kind of levels of granularity that are just going to bamboozle your strategic decision makers and drown everyone and mean that you don't get anything done. You're going to have levels of thinking about that. So that's going to work proportionately and smartly for you. And if you're using measures across the system, you need to have a framework which is accessible and which is understandable for people so everyone can see where they fit into it. Kind of old-fashioned idea of a golden thread maybe, but so that you know where your work speaks to the outcomes that that partnerships and communities are trying to deliver on, and that there's feedback loops so that that stays a dynamic, connected, reflective part of your system. And the other value is that that information that you collect is used intelligently and collaboratively. I think there's a lot of kind of history of performance information and outcome measurement being felt to be something which is there to trip people up, used as kind of an unhelpful competitive environment. So there's something about a culture whereby people feel like their voices will be heard in interpreting complex data, triangulating different types of data from maybe kind of process, outcome, experience, so that there's a really informed picture. So we would say those are your values, those are your things to hold on to when that kind of richness feels like a right mess. In Thrive, we've got this framework which really helps us thinking about the macro, the micro, and the meso and the micro. So I'm going to go through those, but essentially the macro, that kind of population level, area level, how agencies are working together across the patch. That's the kind of area of your joint strategic needs assessment and your community plans and things. Then the meso being more how services and teams are working to support needs-based groupings. So that's more likely to be kind of more specific, targeted, something you can build a logic model around. I'm doing this to achieve this. And you could, that's where you're going to leverage your resources a bit to influence some things. And then at the micro, that's the level of individual care and support, individual interactions and the goals and outcomes of specific people. So just a few reflections on each of those. At the macro level, this is your strategic decision making. So it's kind of a state of the nation. And it's important to be aware that at this level, responsibility is shared and that change might not be easily attributed. So it's important to have this. And this is often a level where the outcomes are the kind of, when you do a consultation with children, people and families, they may often speak to this macro level, this more strategic picture of what healthy and well looks like to them, what's important. But yeah, so so it's really important to be keying in with it, but it's important as well that it doesn't belong to somebody in a way that becomes unhelpful and that it's a kind of collaborative partnership approach. And then at the meso level, the service level, this is where services and teams are responding. So they're going to have probably a more specific brief here. And this is where they're going to be balancing what's different reporting requirements, different people. So we're going to be looking at a mixture of measurement tools which are perhaps specific to a particular kind of help or a particular discipline, and ones that can be used more collaboratively across services. So for example, you may look specifically, I'm trying to think of a slightly, you may use a very specific outcome measure tool, for example, around OCD or trauma or something like that. But that might not kind of be so important at a cumulative level, but you might use something which does translate very easily and is also helpful for cross-service conversations, like a picture of what the child or family's goals are is something which can translate across different service sectors. And often in some areas, something like the Strengths and Difficulties questionnaire is also used in that way, or information like schools attendance, which people can work on from a number of service perspectives and hold in mind as something that's the change that they want to see. So at the service level, particularly, it's really important to be looking at the outcomes or what happens as a consequence of the service, as the support you're offering, but also experience of care, so kind of experience of service as reported by the child and their family, or maybe their waiting times, or whether or not they're engaging, and also kind of activity, so your productivity, the number of people you're seeing, who's using different pathways, which obviously all of these information, as this rather complex diagram shows, they're all parts of cogs in the same wheel. So if you're not paying attention to activity and what you're doing, that's going to interact with the experience that service users have, and also interacts with their outcomes and whether or not you see the impact and the change that you were intending to. So here's an example of how specific things get. The children and persons mental health outcomes metric. Yeah, I don't know what I was going to say about that, but that is a example, I think, of how the meso level becomes specific to services, and that's obviously strategically key for mental health services, but not so much for education services. And it's about that kind of building that awareness and collaboration and seeing where the two things do fit together, and having these in a framework where you can talk about together about how these things are shaping your work, and make sure that becomes a complementary collaborative process. And at the meso level as well, although this can be true at the systems level as well, but I think that I was thinking about monitoring of the impact of a change programme, and thinking about this question that you might also want to be looking at, which is, are you successfully embedding Thrive the way that's intended? And I imagine that's going to come up when Angela speaks. And I was thinking about how something like Thrive and a service transformation is part of a mechanism for change. And I thought it might be helpful to just include this model, which just to clarify that sometimes this model is a way of thinking about outcomes that says, well, you've got your target people that you're working with, your activity that you do, and then at the end, you're hoping you'll see a change in your outcomes. You're hoping that your intervention will support a change in outcome. But along the way, there are lots of things which are actually really key to making that intervention have those outcomes, and those are your change mechanisms. And I think that when we implement Thrive, we're hoping that the way we implement Thrive will be what enables the outcomes to happen. And it's very important to be monitoring that if you're putting lots of energy into making that happen, and to see whether or not that throw-through is happening. So that's another key aspect. And then at the micro level, we've got those individual, so the principles here, it should be meaningful, integration, transparent. And it's really important to remember that every time you ask a question, you're telling somebody what you think is important, or you're telling them that you think that question is relevant to how you respond to them. And when we spoke to young people, we've young champions at the Anna Freud Centre have just finished working with us on a lovely video, which I do encourage you to have a look at. And they talked about what mattered to them when those outcome measurement tools are used, and what makes it work well for them and when it sometimes doesn't. And they really highlighted these things. You need to explain to me why you're asking me to fill it in, and make it part of our session, our relationship. And you might need to support me, it might be upsetting, and I need to understand that you see any one questionnaire as only part of building a bigger picture. I thought that was really helpful feedback, because when we think about the cross-system outcome framework, that's what we're holding in mind, that it's a holistic picture, and that we shouldn't just look at one piece of information, we need to hold in balance. They said, give me a choice, and they said, if I trust you and understand where you're coming from, it will be more meaningful. And I think that level of I need to trust you and I need to come is really at the heart of how you might go about developing this. And at Cork, we are in the industry of outcome frameworks, and we've got kind of lots of tools and detailed action plans. But at high level, we go about this by thinking about your outcome framework first, then your measurement framework, and then how you operationalize that. So Your outcome framework involves that joint commitment. It involves thinking about your strategic context, but it also involves very much engagement and consultation about your local area and what's happening for you. And it really needs that strategic vision and buy-in. And then at the level of the measurement framework, what you're looking at is what is the best practice about the different kind of tools and measures that are in use, what's currently actually in operation, and what are the pros and cons of how that's working. And then thinking really practically about how information can be collected, reported and used, so that your successful measurement framework is one which is realistic and which is probably involves trade-offs and prioritization of what you really think is important, not measuring everything under the sun that you can't act on, but making clear choices about what information flows where and for what purposes. And it really needs to be meaningful at delivery, because otherwise your practitioners are just going to vote with their feet and not engage. And then on operationalizing it, you're looking at all those enabling factors around infrastructure, processes, training. I'm realizing I'm tight on time, so I'm sorry, I'm rushing. Yeah, so that approach is very time, it's going to take time. You need to take a staggered approach and you need to follow through, basically. So some of the different approaches that people have used to build this common thread and this cross-outcome, cross-system approach is to think about in some areas we've seen people use common measures which they've asked people to use across different types of support and care, and that can be really helpful and often is about a shared ethos of kind of using feedback, or it might be a simple measure of functioning like the rating scale or something that everyone can use and engage with, and that embeds feedback and embeds outcome measurement in a system. Some people using goals as a common thread. And that might happen at a couple of levels. It might be that everybody is really trying to use a goals-based measure, and it might be that a big consultation around young people's priorities is the core of your thread, and all of your outcome measurement follows from that. So change implementation, it involves urgency, energy, it involves people working together, and clear communication, thinking about short-term wins, but making sure that it gets anchored and sustained. And in Cork, we have a framework that thinks about the opportunities, the motivations and the capabilities. This is a behaviour change model that support really embedding outcome measurement. That's kind of an evidence-based approach that we know is associated with improved use of outcome measures, and when these things are in place, people do use outcome measures more. So we've got a bit of a process of self-assessment, a survey, and areas for improvement and action planning. But essentially these are the components you need to be thinking about in making sure those outcome frameworks stick and that they are embedded. You need to be thinking about your leadership and management and how the data is actually embedded and used. You need to be thinking about making sure that your staff development is there, so that practitioners are supported to use the tools that they expected to, that infrastructure is there where appropriate, and that service users are at the heart. And if that happens, then everybody gets on board. Okay, sorry to run over.
No problem at all. Thanks very much, Kate.
Time for questions later, haven't we? So
we do, yeah. So thank you. Really helpful.
You're on mute, Rachel.
Am I? Oh, that's strange.
I can hear you.
No, I think you're okay.
I can hear Rachel.
Okay, great. Thanks very much. Sorry, Kate, if you can't hear me too well, but yeah, really, really good overview, and I'm sure it's provoked lots of thoughts from participants today. If you could hold on to those, or do put them in the chat if you want to get some additional response from Kate. Maybe that Kate can't actually quite hear us at the moment, so do please put any questions in and we can ensure that we are able to respond. I'm now going to hand over to Angela Daniel, who's going to give us an overview of the work that's taken place in Greater Manchester, developing a system-wide approach to the outcomes and the impact of the work they've been doing there. So over to you, Angela. Thank you.
Thank you, Rachel.
Great. Perfect.
That working?
Yep.
Okay, so
I'm just trying to go through a little bit of our journey in Greater Manchester and about how we approached a framework that tries to capture something so huge as evidence in a whole system transformation. The other thing I've tried to do as well to make it a bit interesting is it zooms in and out. I'm hoping I don't make any of you travel sick from this, but I will give it a go anyway. So we've been doing this program for about 2.5 years now. And at the very beginning, it was like, how do we evidence at the end of this, years down the line, that we've actually embedded Thrive in every part of the system, not just in health services, but in voluntary sector, communities, education settings, local authority. How do we evidence that we're actually doing it at every level? So we brought together a framework of the various areas, one of which is the self-assessment, which you'll probably be aware of, which is developed by the national team. And this has you self-assess yourself against the different principles, and as Kate mentioned before, the macro, meso and micro levels. So we got all our 10 localities at the beginning in 2018, before the programme started, to do the benchmarking of where they were on that macro, meso and micro level in those 10 areas. We then got them to each year to update that on the macro, meso and micro. So that's from a strategic point of view, where do you think you are on those levels of embedding and implementing Thrive? And this is an example, and I've taken the localities out because I just want to share the graph, but this is this is the macro level, and trying to show over the years, have we made some improvements in embedding and implementing Thrive to various degrees. And then at the meso level, and all we did was add all the scores together there, but each principle is different. And that shows you on the meso level, and this is just something over the years we can do and see a maturity of the system and implementation. And this is at the micro level, and you can see in some areas that most areas it's improved, and then there's a couple of areas, or one area particularly, the it's different. And there's actually reasons behind that in that locality of system change happening, and we can see that, and we can support that going forward. We've got this strategic vision of where we are up to with implementing Thrive, and then we have the CAMS data, which we collect on a Tableau system, which I think you'll all be aware as well. So the Tableau data, this is about measuring your flow within a CAMS services. And the thing is, when you're implementing Thrive, it's a bit hard to embed Thrive within CAMS services unless you have done it in the wider system. So for example, if you're changing your flow within a CAMS service at a service level, it's very hard to embed ending treatment unless we've really got some great advice and signposting offer out there, and have we embedded risk support. So there's parts of the wider system that needs to be in place really before you can start seeing the flow and the change within a CAMS service. So this is the data that we collect that you'll all know. And then the other part we started to look at is, and this was a little bit from Warrington as well, who developed a bit of the framework about Thrive. If we did implement Thrive and years down the line, and it has embedded in every area of the system, then we should actually have a positive impact on some of these strategic outcomes. We can't hand on heart say it's Thrive, but years down the line, if we do have such a system that supports mental health and well-being, then we should be able to benefit and improve some of these indicators here. And then alongside that, we do have the young people statements, that those first 10 that are on there, first 11, sorry, that are on there. And when I looked at these at the beginning of the programme, I realised that if we did embed and implement Thrive in all its principles and in its way, we should meet these statements. But how do we know? How do we know we've done it? How do we know from a young person's point of view that we have done that? And I'll go into detail a bit more about that. So we've got the strategic bit, we've got the CAMS data, that's a flow measurement within a CAMS service. We have some wider indicators that we should impact on, but we can't hand on heart say. And we've got the young people one. But actually, if we embedded Thrive, how would it feel different? How would it feel different at those different areas of thriving, of advice and signposting, of getting help, and etc. So we went through and looked at a lot of it around those 7-minute briefings that the national team produced, and it was a little bit like, what's that vision at the end? What's that vision? If we put it all in, what does it look like? And things like tiers are replaced with a whole system approach and needs-based groupings. How do we know? How are we measuring that? So we can measure that from that the self-assessment, but also things like children and people are active decision makers. Well, that's embedding that shared decision making. So how do we know we've done that? So some of the things we've done is created surveys, and I'll go into those, but we're surveying our workforce. How does our workforce know that they're doing shared decision making? Do they know they're doing it? Are they doing it? And if they think they are, and the strategic level thinks they are, do our young people feel it? Are they feeling that they are active decision makers? So we also put surveys out to our children and young people as well. And I'll go, like I say, I'll go into detail about that. But we've actually linked it to that youth charter statement. So some of the statements our young people have said, if we're doing it, if we're embedding it and implementing it properly, these surveys will capture that and that should meet it. That's some of our thinking at that very beginning. So alongside this, we had an implementation plan, which you'll probably remember, or you might know about. The national team created an implementation plan about implementing Thrive at different levels. So what we did at the very beginning is in our localities, and it's really important here that this wasn't a competition. That's particularly why we didn't use the colour red, the big warning thing. This was just have you done it? Have you not done it? Is it partially or is it planned? And then how do we support that happening in the areas? So, and this was, we did this at the very beginning because we know some of the areas in Greater Manchester were part of the accelerator site for Thrive. So we wanted to know whereabouts are they in implementing it. So this was a way of capturing that, and then we did it in 2019. But what we did in 2020, COVID, what we did in 2020 was we realised really, as we got to undertaking the redesign workshop, it's bigger, it's huge. It's so much bigger than just redesigning one part, because when you're doing a whole system implementation. And by that time, we had a real understanding about our vision of what we wanted Thrive to look like as a whole system approach. We understand it, what we want services to look like, how we want our consultation model to look like. So we've replaced it now with some Thrive standards. And again, that's a learning. They're not standards that are set in stone, because this is all new. So these standards are things like having a single point of navigation in place. That can look different in every locality. And what we're trying to do is learn from places that have got them in place. What's the key things that work and what doesn't work? And how do we share that? How do we put our implementation stories? And I'll go more into detail. So we had an implementation plan. So now go on to the surveys that I mentioned before. So we developed surveys that will go out to all our CAMHS workforce to try and capture how we're implementing and embedding Thrive. They go out to our wider workforce, and that includes our local authority, our health, our voluntary sector, and education settings, to understand, are we getting out there? Are we doing a system change that is feeling it on the ground? We send surveys to our children and people that have been in CAMHS services, and we also send surveys to our children and people who have been signposted to other services, because we don't know what happens there a lot of the time. And how do we capture and understand whether that part of the system is working for our children and people? Are they actually embedding the Thrive principles? So what does it show us? Well, we've done 2 years of CAMHS workforce surveys now. And this is a little bit of an overview of the survey returns from our different areas and a sample. And some of the key findings, and this is from last year's, doesn't include this year's, is that, do they know about other mental health services that are available for children and people outside of CAMHS? Do they feel confident in signposting children and young people? Are they confident in carrying out shared decision making? These are all the things that we're trying to bed in that workforce training, in that system change. Are they confident in having conversations related to ending treatment? Now, it's interesting to read this bit when we get to the children and people's bit in a minute. And are they confident in delivering the key aims of Thrive, and what training, etc. So what we have found overall this year, I'll just show you, this is an example then what we can show localities in their area. So this is an example of Bolton. So we're taking 2019 and now we've got 2020 data that we've just finished our surveys in December. So Bolton can have a look and think, all right, how are we implementing this? How's it going in our area? Do we need to do a bit more with our CAMHS services? And overall, what we have found this year is that there's probably quite a bit of more work we need to do with our CAMHS services. So that's a little bit of learning that we can get, knowing what this comes down to on the ground. So in our wider workforce, again, an overview, we have a bit of a skewed really here, because we had quite a lot coming from one locality, so and some small percentages from others. A little bit different this year. We've got quite a number bigger in the other areas. But so we've sent this out now, like I say, to all the different areas, and some of the key findings about the knowledge of Thrive, about whether they know what services are available to children and young people, are they confident in signposting, and this is all things that our training is trying to improve. Now, we don't expect this to be big or high at the beginning, because we're very early into the stage. This was last year's data, by the way, as well. What we have found in our workforce one, the wider workforce, is all this has improved, all of it, throughout. So that's really, really positive. But with this is for the long, this is over years. We're not expecting massive change and impact yet. This is going to take years for us to embed it in all those different levels, but at least we understand whether we're going in the right direction. So we've got things around whether they believe they work in an environment that supports children and people with emotional health and well-being, whether they're confident in delivering the key aims of Thrive, etc. So then a locality example of this, again, we just picked Bolton, is that overall you can see an improvement across the board there. But about understanding what services are available, we delivered a great online advice and signposting, and a lot of people have done, to be fair though, around that, a lot of people have done a lot of work around COVID, around mental health and well-being, so that might have impacted on it as well. But it gives us a bit of an idea about how we're getting out to our workforce on the ground. So alongside that, how does this impact for our children and young people? And we're just doing our the second year of children and young people surveys at the moment, which closes the next month. So unfortunately, I can't share that bit with you. But there's 56% do not know whether what services are available to help their emotional health and well-being, and that's something we really need to improve out there, that knowledge. There's a bit around preferring digital. So that really feeds into, okay, how do we think about our advice and signposter in localities, knowing there's a certain percentage, majority still prefer face-to-face, but there's a certain percentage that would prefer digital. So what's our digital offer? 28% feel that services speak to each other. So, you know, how integrated and working together are we doing? We know that one of the outcomes within the Thrive bit is it reconnecting back into services when they need to. Only 39% know that. And then if we go into signposted, there was something about shared decision making. I don't think a lot of them felt like they had felt like they was involved in shared decision making. So young people signposted, and if we're looking here again, 75% preferred to access it in person, know what support available. So we've got all this different information now down to children and young people. That there's a lot more questions in this, by the way. This is just some of the top lines from it. But again, 41% believe their schools offer an emotionally friendly environment. If we look at the wider workforce returns, there's about over 90% that think that they have an emotionally friendly environment. So there's something that's not adding up there, of different views. Alongside this, we've also got a life readiness survey that this is one that's done across Greater Manchester, over 7,500 students, and we managed to get some questions on, because one of the areas we couldn't get any information really is around that thriving bit. What's the population thinking and feeling, and how do we impact that? We know the ones that are in CAM services, and we know the young people that are targeted into signposted. So we got a couple of questions added onto this survey. One of those was around, do our young people know how to improve their own emotional health and well-being? And then the other one was, do they know where to go or who to speak to if they need help in improving their emotional health and well-being? And the particular areas there where you're thinking around, I think that female, a lot less than men, and especially around our disabilities, and BME. So there's a bit of work that we're getting some information back here from these surveys. And then our other question was, who would you ask or where would you go for help with your emotional health and well-being? Now, we focus most of our training, our skills and our knowledge from the teacher down in mental health and well-being. We miss out on the most places where people go to talk to about their mental health and well-being. And there's something I think there's a bit of work for us to do, especially in Greater Manchester, but I suppose this probably resonate with yourselves as well, about how do we get some of this confidence and knowledge into those first 4 cohorts. How do we do that? We've got some ideas that we're working for in GM, but it's just stark when you see it like that, and then you realise, hang on, we're focusing all the way down here. So that gives us the survey information. So alongside this, as you know, with Thrive, we deliver training, and so the training that the national team has developed, advice and signposts, and shared decision making, ending treatment and risk support. And so we have lots of data from that as well. So we have numbers of people who are trained. We know which backgrounds they come from, which localities, what professional backgrounds. We've had a lot from the wider system that comes on the training. We went online this year with COVID, and it's been really well received and evaluated, and we do respond to the evaluation. So we know that from the advice and signposting from people going on there, they like the training, but it was really generic. And it was like, well, I want something tools and interesting that's and useful for me in my locality. So this year we've worked with each of the localities in developing training that actually has the generic training around advice and signposting, and then the specific information for that locality. So I'll take Bolton again. We've delivered that online, and the Bolton then delivered their own bit about what does advice and signposting mean in Bolton, where can you know, if they've got a single point of navigation they're developing, what's the future plans, what services can they use, which has been really, really well received. So that's a little bit, that's another area of evaluation and data gathering. And then this is really probably the most important bit. So we've got the bit about, we know the system from a strategic point of view that they feel are embedded in it. We know we're going through our project plan in that area. We've got the survey, so we're understanding from workforce and showing young people what is impacting on it. We're developing the culture change through our training, but actually the evidence of the Thrive of happening across RGM is in these implementation stories. So we have evidence across around single point of navigation, single point of access been developing. We know transformational change is happening in areas. We've got supporting of vulnerable groups around consultation and supervision models that we're looking at. We know we're broadening the offer. There's certain areas that are now looking at voluntary sector that didn't even have a voluntary sector offer before, because we know that coming from the approach that not everyone gets better in mental health services, how are we as a system supporting them? We know there's Thrive working into schools. We've got navigators, school link workers, Thrive, whatever you want to call them, they're all different names, but similar roles being implemented. We have pathways, digital front doors, Manchester. So, and we capture that in these implementation stories. So this is where you get the details that Kate was alluding to before about specialized measurement tools. This is where this should be gathered. You know, this is the evidence of impact and information. So we have system change. We have Thrive being applied in a service. We have Thrive being applied in a pathway. Alongside this, there's this big system change happening. And now we're capturing that. And hopefully our framework kind of overall captures it. We've got examples of consultation, and that's a big area we're working on at the moment. If we want to broaden the mental health offer, we really need to broaden our consultation offer from our mental health professionals into the system. And then options, we need more options for our children and young people. As we know, there's lots of different ways of improving people's mental health and not one size fits all. I'm hoping I'm not going over. Okay, so what's next for us? Well, we need to work a little bit more with our localities about evaluating impact. So an example of that is in Manchester, they're developing these Thrive hubs. So one of those is going to have CAMHS workers, voluntary sector, early help, working together within a neighbourhood, engaging and supporting education settings and other services that work within place. How are they evaluating that? What's the child and young person's journey? How is it different in having that in place than another area in Manchester where that isn't in place? Are we gathering that evidence from the very beginning? And that's the bit that we could probably help with as a service. And then there's a real gap around parent carers. So our surveys touch the workforce, it touch the children and young people, but there's a voice of parent carers that we're missing. And that's something we're going to work on going forward as well. Thank you.
Brilliant. Thank you, Angela. A huge challenge to give an overview of the impact of the fantastic work your team have been supporting the localities with across Greater Manchester. So well done for that. Now, a few questions have been posed in the chat while you were giving that presentation. So it might be that some of them you can respond to while we firstly take a break just for 5 minutes, and then Kat does her presentation, because we'll then have the Q&A at 1:45, hopefully. So just in terms of timekeeping, if we literally just keep it to 5, or if we could come back at past, I know it's just time to flick the kettle on, nip to the loo, do some star jumps, and we'll come back at past to continue with Kat. Okay, thank you, Angela, and see you all in 4 minutes. Okay, well, hopefully everybody has come back. We should perhaps do a little bit of a Menti check on how many star jumps people have done in our breaks and see how we build that up. Actually, that's a helpful reminder that at the end of this session, we will be wanting to, true to Thrive Framework form, capture your feedback to really think about how we can improve these webinars and any thoughts or reflections as well. So please do stay on the call to give your feedback, because we really do make use of it in a similar way to how Angela has just presented her fantastic data. So without any further ado, I shall hand over now to Kat Taylor for her to share with us the fantastic work that's been taking place in GM on developing an arts and culture outcomes framework. Thanks, Kat.
Hiya, hello everyone, thanks for that. So just to explain, I think Neelam's going to share my slides for me. I'm having laptop issues, but I'm going to try not to sort of evoke the government press conference with saying next slide, please, too much. My slides are quite basic. So my name's Kat. I'm the programme manager in GMI Thrive on the Arts, Culture and Mental Health programme. And so I'm also a clinical psychologist and I work in CAMHS as well. So I kind of have that, you know, I work with children and young people directly as well. And so today I'm going to tell you a little bit about how we developed the evaluation kit for the arts and culture sector. So Neelam, please, thank you. So I'm just going to take you through what the kit looks like, why we developed it, and that follows on really nicely from everything that Kate took us through. Who we were, so who worked together to develop it, how we did it, what it looks like, and then a little bit about kind of outcomes and applications. Thanks. I can see Rachel, so I just want to actually see my slides. Rather, that would be more helpful, wouldn't it?
So we just change your view.
Right.
At the top right corner, you have view.
Yeah. That's better, thank you. Okay, so I started with this sentence really just to say that, you know, like we've already said, 50% of young people say that maybe the mental health support offer isn't a right fit for them. We know that among half of children who come into CAMHS, 49% of them don't actually improve. And I think coming from an arts and health background, often or sometimes people say things like, oh, what you're talking about is quite alternative, or, you know, we're more interested in traditional treatments, meaning things like CBT, talking therapies, maybe medication. And I think, and again, in terms of treatment, you know, that's kind of doing too. And I think the Thrive framework is very much trying to deliver something that's more aligned with the young person and the family, rather than with a maybe more adult mental health model. When it comes to traditional, I think, you know, with the pandemic, we've seen that the traditional things that people turn to in times of distress are things like singing, or ritualistic things. And, you know, you've just talked about doing star jumps in the break, kind of all these things that give us endorphins and maybe connect us to each other and can help foster bonding. And so there's lots of ways that the arts and culture can support mental health, again, in that kind of macro, meso, in the community, and even on a macro level. So thinking about public health messages and how we get people to think about mental health. So I think we've started from the premise that in terms of broadening the mental health offer, arts-led interventions can offer safe, which I think is critical. You know, there's been no studies finding kind of harmful side effects really. So safe, empowering and cost-effective approaches towards positive and sustainable change for children and young people and families. So I'm just going to, this is just one slide about the background of the programme itself. So as Angela's just mentioned, we mapped current provisions. So that was asking the workforce and the arts and culture sector as well about their experiences and attitudes towards kind of collaborative arts and health programs, such as the one in the picture. So the picture is Company Chameleon, who go into schools using the medium of dance to talk about mental health and sort of psychoeducation really in a really engaging way. The second of our goals was to implement proof of concepts. So that looks like arts-led interventions that are happening within CAMHS services with CAMHS practitioners on board, to try and sort of apply what I'm going to talk about next, which is the evaluation framework. And then we also want to develop and deliver training. Obviously, for any of this to be done properly and quality, with quality, we need to be looking at evaluation as we go. So why did we do this? Sorry, what is it first before why we do it? So what it is, it's an adaptable method to help articulate some of the impact that arts and cultural activities have on children and young people's mental health. And so in practice, it delivers a consensus or an agreed sort of set of minimum outcomes that arts and culture organisations can use to articulate that impact. And we did this through a 12-month cross-sector partnership, which I'll tell you more about, what that looked like. So why did we do this? So our goals were to co-produce an outcomes framework and a name. And the reasons were to address that, well, firstly, the cultural sector is often, you often hear things like the evidence, there's not enough evidence or the evidence is lacking. And that secondly, on the flip side of that, the health sector is therefore limited in its ability to commission such creative programs. Because there's lots and lots of evidence, but the problem is it's quite tailored and everyone does their own thing, really. So the second goal was to try and work with the arts sector to support the use of framework outcomes that are easily applied and appropriate to setting. Because obviously the way that we approach it might be different to the way that the arts sector approaches it. And then to support the arts sector to be able to demonstrate these specifics, as well as the creative, so the specifics being the measures that we're talking about, as well as more creative outcomes and stories, to firstly develop the evidence base, and then secondly facilitate commissioning where appropriate based on that evidence. Thanks, Neelam. I'm just going to let you read this quote just because I think it sets the scene quite nicely about why we did it. So this is from the Centre for Cultural Value, who were looking at the effective use of research. So I think that quote is kind of a nice summary of lots of things that Kate highlighted as well, really, in terms of the complexity and the messiness of what we're trying to measure and how a lot of this stuff kind of escapes measurement, but obviously we need to do something about that. So go to the next slide, please. Thanks. These were some of our partners, not all of them. We had the Greater Manchester Combined Authority as a partner in this. Arts Council England took part in the sessions. So we have the Head of Research and Policy. Lime Arts is a hospital-based arts organisation that's been running in Manchester since the 70s. 42nd Street are currently commissioned by Greater Manchester or Manchester to deliver more creative interventions for children and young people. And they have like a city centre based gallery, and they're quite sort of youth-led. And then we had academics, so Professor Karina Lovell from the University of Manchester has done a lot of work around children and young people's mental health. So this is not everybody that was included, but it's just some of the partners, and I can give more information about that to anyone who's interested. What we did together, so we met over 12 months. We did a series of 5 workshops. So we booked a large room in different places, and for about 2 hours, we paid attention to the data and outcomes that the different groups were interested in. So whether you're an arts practitioner, what are your kind of goals or preferences, clinicians and other decision makers, and then again from having a research, so I come from a research background as well, and it's quite difficult for me at the beginning to get my head around this actually, because we're looking at a sort of adaptable evaluation kit and it's not a research program. And obviously as a research program you'd be trying to do something that's highly tailored to each program, whereas this we were trying to develop something that any program could fit to them. So yeah, so we discussed 4 kind of themes. So the first was demographics. The second theme were routine outcome measures that maybe are used in services and recommended by Cork and Public Health England. Then we looked at qualitative outcomes and measures, or ways to look at qualitative data, and then creative outcomes. And I'll talk more about those in a moment. But for example, if we just take the first one, demographics, we looked at things like how long does that child wait to be seen? Because if you're a commissioner and you know that CAM's wait list is 20 weeks, if on a good day, you know, and then a theatre company might see that child within a week to do some reflective work, you know, it's incredibly important information to know how quickly they might be seen. And we might be thinking about that it might be quite obvious to us, but I think to the cultural sector, things like that, things like number of sessions attended and did not attend, again, they were not necessarily recording when children did or didn't attend. So if they've got an attendance rate that's quite high, but they're not recording it, they're missing out, you know. So we were trying to sort of demystify the whole process for the cultural sector to get them to record things that are important. Postcode we included, partly, well, for many reasons really, but when Arts Council England look at funding, one of the things they're really interested in terms of the arts and culture is who is accessing it, because there's lots of kind of barriers to participation, including things like poverty, educational level, where you live. You know, there's lots of reasons why some people don't feel like galleries are for them, or they can't afford to access them, or they don't have creative resources at home. And so we thought that postcode was a really important thing to include in terms of accessibility and inclusivity. And I think there's one of the reasons that we're interested in that is because there's longitudinal evidence that shows us that people who engage in the arts, meaning, you know, whether you, like I just said about go to a gallery, but also if you go to gigs, if you engage in dance, these all have physical effects that kind of help downregulate the impacts of stress. And so it's kind of it's healthy, and people live longer who engage with the arts. And so I know I'm not here to talk about the evidence, I'm trying to talk about the development of this process, but so yeah, that was just one example of the things that we talked about and what to include. Things that we couldn't include, we've already mentioned things like access to it, how many times people go to A&E or school attendance, but we just don't have the ability to map that at the moment. But anyway, so there was that decision-making process to kind of identify the challenges and then identify what we should include. Okay, so some of the issues to address were people's knowledge and beliefs around the value and accuracies of outcome measures, which we've touched on already today. There's lots of different schools of thought, and I think there's some skepticism about what you can measure, which I totally empathise with. So we were trying to improve general understanding of what to collect and how. We had issues around unfamiliarity with measures, so the language used, or people who are either formally qualified or don't feel qualified to use certain tools. So kind of a bit of myth busting and a bit of kind of what's your fears and how can we help with that. So broadly, that's about a sense of fit between the different ways of working. So what language people use, the approaches and methods, and then lastly, the licenses to use them. So the kit kind of takes people through how to use them. Thanks. So I'm going to show you the kit on the next slide. But this was one of the ways that we tried to communicate this to the sector. So we said, here's a new tool. We know that not all outcomes can be captured, because this was kind of a fear that we thought was important to acknowledge, but that you need to demonstrate impact. So we've said this kit was co-developed to help understand the journeys you take with the young people you work with. So we didn't just want to present it as a, you know, evaluation and outcomes framework that sounds quite jargony and maybe misses out some of that more journey type language. Okay, so this is the kit on a page. It does look like the Thrive framework, which is intentional, but it doesn't correspond to the quadrant. So apologies if that confuses you, but it's just a kind of way of putting it on one page. So if you order the kit, you get like a table of each of these 4 themes, and it tells you what each one is and how to measure it. And then it comes with a database as well, which I'll show you next. But as you can see, oh, sorry, go back one, Neil, sorry, thank you. So as I've said, the demographics and process data is the first theme. And the second theme, we decided as a group that the outcome rating scale was the most appropriate. And that was for many reasons, but partly to do with its kind of everyday language. The other advantage to that was that it comes in different age groups, and I think the practitioners in the room, the researchers as a group, felt that that was the most appropriate and also kind of the most captured the holistic child, all family relationships, myself, and so that was the minimum that we required. And then the SWEMWEB, so the short Warwick Edinburgh Mental Wellbeing Scale, partly because it was so widely used, validated tool, people were already familiar with it. And then on top of that, we've said that people can also use as an optional extra the session rating scale and the goal-based outcomes. And again, these were things that instead of something like the RCADS or the SDQ, which does have more sort of clinical based language or questions that, you know, like the young people have said that Kate described, why are you asking me this? Or, you know, I'm not really here. They were kind of overly mental health driven really, whereas that might not be appropriate in all settings. Okay, so then the third quadrant, we thought it was really important, and you know, many commissioners do ask for more qualitative data. So in the table that comes with the kit, it lists some of the possibilities that you might choose to use, such as a focus group, and then how to do that. And then the final quadrant, I think as a group, we all thought that this is such a creative and maybe an unexpected outcomes. So just for example, I'm thinking of the young people who maybe go from being quite socially anxious, maybe school refusal, but then I've seen children go from that sort of state into performing on a stage or being on the radio. And we thought as a group that those kind of outcomes are really powerful and really important, but that you can't really survey that. And so in the kit, there's a table that says it gives a selection of possible creative outcomes and links to them. So things like exhibitions, maybe songs that people have written. There's all sorts of great examples of performative ways of describing the impact that arts-based interventions have on us, on our well-being. So I hope that all makes sense. I think it's quite a lot to fit into a page. And like I say, when you order the kit, each of these is broken down into a table that you can kind of link to. So if we have the next slide, which is about the database. So I think Sam Gittins is on the call. Sam's our data analyst, data manager for GMI Thrive. And he was instrumental in designing this kind of user-friendly Excel database. So if you can use a spreadsheet, you can use the database. And it's simply, you know, and it comes with a frequently asked questions. It comes with a how to use it.
There is a secret present.
It's supposed to be quite intuitive. And so along the bottom, you can see the questionnaires that people can enter the data, and everything that's in the kit is on this database, apart from obviously the qualitative and the creative outcomes. But each organisation gets their own database to use, and then it also generates reports. So it's supposed to be, like I said, user-friendly and also useful for them, for each organisation. Okay. So the next slide. This is another way that we chose to try and communicate this to our arts partners. So we said arts organisations are good at using creative activities to support mental health. Commissioners are good at using evidence, and the kit is hopefully good at capturing evidence of the impact. And you know, I think it's important to say really that this is our attempt as a group. We had it tested, so we had people trying this out for us and feeding back to us what it was like to use, including the database. But you know, we're quite open to the fact that maybe after it's been used for some time, maybe we might need to change it. It's just kind of like, this is our attempt to meet some of these challenges. So if we go to the next slide, this is when you order it, there's a one-page briefing online. So what's included, copy of evaluation kit, and anybody can have the evaluation kit itself, which kind of is the explanation. But when it comes to the database, that's only available within Greater Manchester, and that's because of some of the tech support that's needed or possibly needed to do that. And then the point of, as I've said, is that, you know, the capability to use this mixed method approach and the metrics used by the NHS, demographic data and creative outcomes. So finally, for the last couple of slides, got a couple of minutes, some of the unintended outcomes were that this group that we've developed, so there's about 16-ish people in each session. It was usually a lot of the same people, but sometimes they'd bring colleagues, and there was a kind of ongoing membership, but we shared minutes in between sessions, and I'd say the level of engagement was really high, and we didn't have any dropouts, which I thought was incredible. If anything, we got more people coming as the process went on. So we've seen ongoing collaboration between a lot of those people. We've delivered training between arts partners and ourselves, so in terms of working in mental health settings, things about safeguarding, just useful kind of practical training. We've seen further collaborations between the academic partners and the arts partners in looking at future things to study. We've seen invitations on further funding bids, special interest groups. There's been we've done a number of articles in national publications and a couple of podcasts. The Mental Health Foundation did a podcast. So it's been, there's been a lot of interest in it, and we hope that we've kind of achieved what we set out to do. So finally, some of the policy recommendations, and I'm talking more broadly now about the arts and health field. So one of the things that have come out of the Creative Health Report and also the World Health Organization's report in 2019 on, what was it called? It was called, What Are the Roles for the Arts and Culture in Health and Wellbeing, a scoping review, and that's got 3,500 studies. And some of the recommendations that came out of this kind of work was that we need to strengthen mechanisms between the sectors, so co-funding programs, routes of referral we need to think about, so that's kind of thinking about social prescribing and some of those links, training. So there's so many things I could talk about here, but one of the things that has been found that medical trainees can benefit from using the arts to kind of hone their reflection techniques or their interpersonal skills, and then also that we need to do research at scale and longitudinally. And then the last slide is just about where you can find out more. So that's the GMI Thrive website and our Twitter account. Then you can request the kit using that link there. There's some articles which is about what I've just talked about, and maybe some of them are more about the programme in general. And then lastly, we have a programme where people can join us to be an ambassador, and that means that you receive free monthly content and sort of resources, whether that's research findings or podcasts or just things that can help you embed this into your thinking and your work. And the last slide is just my contact details again, in case anybody would like to know any more. I think I've said everything I want to say. I'll invariably think of things afterwards, but thank you for listening, and hope to join you for the questions next. Thank you.
Thanks very much, Kat. Really, really helpful overview. So yeah, please do use the chat box. I'm mindful of time, and there've been a few questions put into the chat as speakers have been going through. So Kat, while you just catch your breath and people add some additional questions about that, and I might just go to the chat box because I know that people placed some through. So yes, we'll be sending the slides out. So Susanna, reflection from you around it being really challenging for everyone to understand the need to develop a shared language and understand about system and partnership goals. A specific question, Tim, in relation to routine outcome monitoring, and I know you came back, Kate responded, but you asked a question about the method of collection, so digital systems that can help collate. Do you want to come in and be a bit more specific in relation to what you're asking there?
Yeah, hi Rachel, hi everyone. I think we've been trying to implement consistent outcome measure collection for some time, in people's mental health, and one of the things, the barriers that often comes up is the method of collection. So paper versus digital, for example. The most electronic patient record systems used in mental health services don't have a good clinical functionality for collecting outcome measures, as you probably know, unless they're IAPT type systems like IAPTUS and PCMIS. So my question is, more to the general audience as well, what systems are people using to ensure that, outcome measures are collected efficiently using digital means so that they can be used in sessions as they're intended, so that they score automatically, they monitor progress over time, they can be fed into that kind of clinical rhetoric within session. So we're piloting POD, for example, but I know that's not the only system out there, and there's other things like it needs to flow to the MHSDS and all of that kind of stuff. So I'm just wondering, Kate and others, if you've got other examples where it ticks all of those kind of boxes, or anyone's done some type of options appraisal that they might be able to share. Hopefully that clarifies the question, Rachel.
Thanks, Tim. Kate, do you want to respond to that first of all?
I think Tim's asking just the right question to ask colleagues, really, because obviously we don't endorse a particular system, and as you say, some of them are really pricey and brilliant, and some of them are much more cheaper and more streamlined, and that integration with other data sets is what really can be the clincher. So certainly flowing data to the MHSDS is always a tricky one, the integration with the clinical record and possibly with other providers and stuff. So I think those often are what influences whether people pay for more or less expensive ones. Obviously, there's always an issue with licensing as well for putting the clinical tools on. So that kind of sometimes stymies entrepreneurship, I think, from services. So I'm afraid I don't have super helpful things to add, and I think the right thing is for everybody to be swapping notes. And yeah, I know lots of systems that court members are using, so I'm really happy to link people up with systems they're interested, other people who are using systems they might be interested in, but an easy answer.
Thanks, Kate. I know that Jamie Lee is keen to speak, so Jamie, if you want to share your thoughts on NHS.
Hi, my name's Jamie Lee Keane. I work in the National Children and Young People's Mental Health team. It's actually quite opportune that you're building my business case, because we actually have just engaged with NHSX around getting a bit more understanding of this, so we can give people a bit more direction. Cork, we're coming your way. Kate, we're coming your way if Ari hasn't already. We are literally, as we speak, I know somebody is inputting the details of a business case to get some funding to explore this and do perhaps a discovery around it, so that we can, as Kate said, it's a perfectly insightful question, because I think a lot of people are asking it at the moment. It's certainly what we're hearing. So I think there's some work needs doing about it. We are definitely in the early stages of looking at that work. So hopefully it could be one of the outputs of that piece of work. And secondly, I know this is just a really simple thing that came up on another call that we had, was that when people are using digital and remote interventions, that perhaps whilst they're on that, using that intervention, they could just perhaps put outcomes data straight into the EPR or what sits behind that, just when those opportunities arise. But that's just me just passing information that somebody else said that they'd been doing and was really effective. Just a simple interim measure, perhaps.
Thank you, Jamie Lee. It'd be helpful if sites across the country, because we've got representatives from a number of different localities on this call. So if people are doing some work and we can pull that together. I know certainly within the Tavistock and Portman, we're doing some work looking at how we can incorporate outcome tools into web platforms. So I'm sure there are others doing similar work as well.
Yeah, I think we've already talked about our intention to use this community of practice to advertise the work we're doing when we get a bit more traction.
Yeah, thanks. We
have done some guidance on using measures remotely, that so I'll put that in the chat in case that's helpful.
Yeah, that's really helpful. Thank you. Okay, I'm mindful we've just got a couple of minutes and any specific questions, so people can read the comments. So there's a query from Suzanne Kane to you, Kat, around linking in with professional bodies in relation to the evidence base for the arts and culture work. And I know on a personal level, I've been reading about the recently republished The Arts Dividend Revisited book, Why Investment in Culture Pays. That might be something for people to have a read of, that absolutely talks to this as an issue. But do you want to just respond to that, Kate? Kat, sorry.
Yeah, sure. We talked about this yesterday, didn't we? And about how the NICE guidelines do recommend arts interventions for like dementia. They do in psychosis as well, schizophrenia. So it's definitely something that we want to think about, but we don't work with exactly. So I am in touch with people from arts therapy bodies, but it's not formed part of our work formally. And I think that's something that we should be thinking about, because obviously arts therapy is different to arts intervention, being a can't think of regulated body, and we need to take care that we're not conflating the two as well. So all that's very important. Yes.
Great, thank you, Kat. Now, we can pick up any further questions in the chat and respond individually. I'm mindful there's been a very dense morning, and it'd be great to get people's feedback on the session today. So if people could move open Menti, if you go to www.menti.com on your device and use the code 616380809, that will take you into the set of questions for today's session. Thank you. Great, people are managing to get in. Feedback is really, really useful to us in ensuring that we make the webinars that we deliver as helpful and useful as we possibly can for everyone. So there will be further questions asking for ways in which we might be able to improve it and other areas of interest. I can't move on from this question until we've got as many people as possible contributed, because it will not allow people to join this question. So we'll just stay on it for a moment to enable as much feedback as we can get.
Rachel, shall I just answer the question from Suzanne about the challenge for pressures and expectations? So it was about that pressure on CAMHS to change from the very beginning when you're embedding Thrive, but we managed to do it as a system. So yeah, I think it was it is a bit of an issue, because there's something about changing people's views of the mental health system itself anyway out in the system. So you know, at the moment or in the past, it was always been anything to do with mental health, it's CAMHS. So you have to really get that language back out into the system to say it's not just CAMHS, and we've all got a role to play in it. And I think that's really pivotal to do prior to trying to get a CAMHS transformation. And as I was saying, a lot of it you can't really embed. So we found that from the very beginning. We start the training that first year around advice signposting and ending treatment, but unless you've got the other parts of the system in place, it's very hard to embed that training and making it work and understand. One of the big influences I think that we've done is having that whole system vision about what Thrive would look like in actuality. It is driven by our CCGs, so that was the whole big sign up for it, and because we've got the GM Health and Social Care Partnership, I think they understand that it has to be a whole system together. So there isn't just that pressure on CAMHS, there is that bit about, come on, let's have a whole system approach to this. So we've been quite lucky in that way, but we do feel that now's the time to really get it embedded. And most of the systems now in our GM, our CAMHS services, have now got ways of recording the little needs-based groupings as well. So hopefully we can develop that a bit more going forward.
Thanks very much, Angela. Okay, so that's a very helpful point. We could just respond to any other queries people are needing to leave, which fully appreciate. So there aren't any statements coming through. I wonder if we're not able on that one to collect data. It might need a bit of a refresh on the Menti. No options available here for this question. Just needs a bit of an edit. Apologies for that on the Menti. Okay, so if you stay with it, it will just get amended to enable people to give some feedback. Okay, I'm mindful that people do need to start thinking about leaving, people going to meetings. And Tim, you put in, please can people share examples of screening measures or suites of e-measures used at triage or initial system assessments? Please can people share, thanks. Yeah, so if people want to share those with the iThrive team, we can disseminate them. As Kate said, on the Cork website, there are a range of tools that are available to use in a remote way. So do also look at that as well. Okay, it looks like the Menti has been amended, so please do leave any comments in the around any particular areas that were helpful. And for those who maybe have contributed to that, just needs to a bit of a time lag in some of the data showing. It will also be really helpful to know about any future areas, which is the next question. So do let us know, or you can also share that with the iThrive team, where we can ensure that the webinars are bespoke for your needs. So thank you all. Do keep, if you've entered something into Menti, please do progress on to the next question. We'll draw it to a close there. But thanks to all our speakers for their contributions today, to Kate, Angela and Kat for sharing your fantastic work that you're doing in relation to outcomes and supporting, giving that information to support sites across the country in evaluating the outcomes and impacts of the work that they're doing. So thanks all, and we'll end for now. Bye.